Hi guys, today I will be discussing about the most important topics to be studied in anatomy. They are arterial supply of various regions, cranial nerves, their nuclei, and their courses, brachial plexus, its branches, and various palsies of brachial plexus, the dermatomes of upper limb and lower limb, nerve supply of perineum, the gluteal region, ear, and eye. In embryology, the important topics are derivatives of different germ layers, especially that of neural crest, branchial arch derivatives, spermatogenesis, and oogenesis. In osteology, you should study the various foramina, especially that of the skull base and the various structures passing through it. The shoulder joint and knee joint should be studied in detail, including various ligaments and other structures around these joints. You should also study ethmoid bone, sphenoid bone, and the various walls of orbit and nasal cavity in detail. In neuroanatomy, most important topics would be cavernous sinus, its boundaries, tributaries, and other connections, and blood supply of the central nervous system, especially that of the internal capsule and cerebrum, and the ventricles, various the boundaries of various ventricles. And in histology, you should make a list of various epithelia covering various organs, and also include the images of the same. As far as general anatomy is concerned, the most important body part to be covered in detail would be perineum, the superficial perineal pouch and deep perineal pouch, and all these structures are really important. In recent years, many questions have been asked from the perineum. Now coming to the images which are usually asked in anatomy, they are branches of aorta and the main branches of subclavian artery, and the anastomosis around scapula. Also study arrangement of the femoral canal, circle of Willis, blood supply of the brainstem, dural venous sinuses, portosystemic anastomosis, and cavernous sinus. Study the course of cranial nerves in detail, especially that of the fifth nerve and the seventh nerve. And as I said, the dermatomes of both upper limb and lower limb. The images given in the Kittelmoor is usually considered as the standard as far as dermatomes are concerned. Also study nerve supply of various parts of the ear, anatomy of the internal acoustic meatus. So you should also study various structures passing through the diaphragm and the muscles of mastication and their origin and insertion. You should be able to identify these muscles in both cross section as well as the coronal section. Also, you have to study their actions as well. You should also study the opening of meatus of paranasal sinuses, the superior and inferior orbital fissures. In embryology, study the diagrams showing different parts of mesoderm, neuroectoderm, and endoderm, the branchial arch derivatives, aortic arch derivatives, the development of diaphragm, types of tracheoesophageal fistula, the development of the kidney, and various anomalies like Meckel's diverticulum, urachal cyst, urachal sinus, etc. In histology, as I said, you should be thorough with the epithelia of various organs and the various types of cartilages as well. Also, the lymphatic organs are important, including lymph node, spleen, and tonsils. Also study the structure of plasma cell and eosinophils. And in recent years, there's a trend of asking the various glands, especially the sebaceous gland. So you should also be covering that in detail. Thank you.